So let's talk about this Yale study, which has just been leaked, that is being done at Yale University. And the goal of this study, of about 4,000 participants, is being done with one purpose: how to convince Americans to take the coronavirus vaccine. Now keep in mind, the coronavirus vaccine that's out front, that most seems likely to get to market first, is one being created by Moderna alongside the National Institutes of Health. Bill Gates is a funder in this. Dr. Anthony Fauci, obviously with his NIH, is a big part of this. And remember, of course, Moderna, for their part, has never actually brought a drug, any drug ever, all the way through FDA regulations and trials to get a drug to market. They've never done it. And yet they are the company leading the way on this brand new coronavirus vaccine. So Yale University researchers are now looking at a 4,000 person study to try to figure out how to best create messaging, though the right term really should be manipulation, to persuade Americans to take this vaccine when it does come to market. The study tests different messages about vaccinating against COVID-19 once the vaccine becomes available. Participants are randomized to one of 12 arms, with one control arm and one baseline arm. We will compare the reported willingness to get a COVID-19 vaccine at 3 and 6 months of it becoming available between the 10 intervention arms to the 2 control arms. Study participants are recruited online by Lucid, which matches census-based sampling in online recruitment. So take a look here at the arms and interventions. They use a sham comparator control, a control message about bird feeding. 2 out of 15 of the sample will be assigned to the pure control group, which is a passage on the costs and benefits of bird feeding. Under that are the experimental comparators. For instance, the experimental personal freedom. 1/15 of the sample will be assigned to this intervention, which is a message about how COVID-19 is limiting people's personal freedom, and by working together to get enough people vaccinated, society can preserve its personal freedom. Which of course makes no sense at all. You will have personal freedom if you comply and do what everyone else is doing, regardless of how you feel about it. Another experimental, social pressure through guilt. 1/15 of the sample will be assigned to this message. The message is about the danger that COVID-19 presents to the health of one's family and community. The best way to protect them is by getting vaccinated, and society must work together to get enough people vaccinated. Then it asks the participant to imagine the guilt they will feel if they don't get vaccinated and spread the disease. Another social pressure they want to use: embarrassment. 1/15 of the sample will be assigned to this message. The message is about the danger that COVID-19 presents to the health of one's family and community. The best way to protect them is by getting vaccinated and by working together to make sure that enough people get vaccinated. Then it asks the participant to imagine the embarrassment they will feel if they don't get vaccinated and spread the disease. Then they're trying to use the social pressure: anger. 1/15 of the sample will be assigned to this message. The message is about the danger that COVID-19 presents to the health of one's family and community. The best way to protect them is by getting vaccinated and by working together to make sure that enough people get vaccinated. Then it asks the participant to imagine the anger they will feel if they don't get vaccinated and spread the disease. Now, here's my favorite one: trust in science. 1/15 of the sample will be assigned to this message about how getting vaccinated against COVID-19 is the most effective way of protecting one's community. Vaccination is backed by science. If one doesn't get vaccinated, that means that one doesn't understand how infections are spread or who ignores science. Trust in science, they say, is not based upon trusting the fact that, by the way, not all vaccinations work for all people, and by the way, even the flu vaccine that is taken by millions of people every year only affects 60 to 40% of those who actually get the vaccine. We'll talk about about that in a minute, because the CDC's own numbers show only 40 to 60% of the people who take the flu vaccine actually have benefit from it. And finally, the experimental not bravery arm. 1/15 of the sample will be assigned to this message, which describes how firefighters, doctors, and frontline medical workers are brave. Those who choose not to get vaccinated against COVID-19 are not brave. What are we, 5 years old? You're going to try to convince people to take the vaccine by calling them scared? You're too scared to take this vaccine? By the way, many of the people who would refuse to take the vaccine, it's not about a lack of bravery, it's about a courage of conviction. And that conviction is that they don't trust how this vaccine is being manufactured or the profit motivations behind it. That's not about cowardice. It's about courage of conviction. But going on from there, Microsoft co-founder Bill Gates has said that people could need multiple doses of a potential coronavirus vaccine to immunize themselves from the coronavirus. If necessary, the multiple doses could require more than 7 billion vaccinations to be administered worldwide. And of course, all the manipulation in this Yale study does not take into account the fact that actually, as I said, with the flu vaccine, it is not always effective. And from year to year, who it's effective on and how it's effective changes dramatically. In fact, in 2012 to 2013, the H3N2 component of the flu vaccine was effective in just 39% of people. Researchers from the University of Chicago, Harvard University, and others show that poor immune responses may explain the low effectiveness of the vaccine that year. And by the way, even the CDC admits that on any given year, only about 40 to 60% of the population actually benefits from the vaccine that they have taken. The flu vaccine can reduce the risk of flu illness by between 40 and 60% among the overall population during seasons when most circulating flu viruses are well matched to the flu vaccine. You notice that wording there, when it is well matched. The reason for that is because on any given year, vaccine makers make a vaccine for the wrong flu strain. They don't know which flu strain is going to be especially predominant. So there are millions of people who can take vaccines and have it for the wrong flu strain in any given year. Again, the idea of what Yale is pushing here is that if you trust science, if you are brave, if you are a good person, a compassionate person, a person who cares about their family and their neighbors, you will do this. You will take this vaccine because by taking the vaccine, everyone is safer. And yet the simple, basic science of vaccines, even if you believe completely in vaccines, we're not even going to debate about the side effects of vaccines. Even if you believe that they absolutely work, no side effects, the reality is, even by the CDC's own numbers, they're only effective on any given year in 40 to 60% of the population that takes them. But the real reason for this Yale study is because even with the flu vaccine, less than half of the US population actually takes that vaccine on any given year. And that is the number that Big Pharma is afraid of, that Bill Gates is afraid of, that Anthony Fauci, that half of Americans won't take a flu vaccine, and it's likely that even fewer will be willing to take their coronavirus vaccine.